All right, Thursdays always, and we kind of bring the folks in for the medical community. Did you know that stroke is one of the leading causes in disability, the 5th leading cause of death in the U.S.? So today we bring in Dr. Vinodh Doss with New Hanover Regional Medical Center with the Interventional Stroke Program, talking about stroke. And one of the things we want to get right into with stroke is if you are in that position where it becomes necessary to get under the knife. This is one of those things. Time is always of the essence when we're dealing with stroke.
That's right. I mean, 80% of strokes we know are preventable, but a lot of times people have risk factors that aren't well treated and will develop signs and symptoms of stroke, and that's why it's important to recognize them very quickly and to get treated quickly in our emergency room. That's where we can really help the patient the most.
I know, we always push, you go through fast. That's the way to recognize the symptoms of stroke. When they get to you, what is the most urgent thing that you're looking for, especially when we get to surgery?
So, to treat stroke, you have to be very aggressive up front, and that's why it's important for the patient and the families and the people around them to recognize the signs and symptoms of stroke. That's why we have the nice acronym FAST: face drooping, arm weakness or leg weakness, speech difficulties. That means it's time to call EMS. EMS will see the patient. They'll say, hey, this looks like a stroke. They'll bring them to us. Our stroke team will see the patient. When they see the patient, they'll assess for stroke. Could this be a stroke caused by a small vessel? And then there's stroke caused by a large vessel. And then they go through the treatment paradigms. They'll assess for a clot-busting medication. And that's when I kind of come into the picture. Does this patient have a type of stroke called a large vessel occlusion? And we go through other testing to confirm that, as CT angiography. If they have blockage of one of the major arteries of the brain, then that's when I come into the picture. I can do a procedure called stroke embolectomy, where I thread a catheter from the groin up the belly, up the chest, into the neck, and take a small catheter up into the artery of the brain. A stroke is essentially blockage of one of the arteries of the brain. And so the idea is once you get that artery open, it restores blood flow and it gives the patient a chance to save brain. So I go up there, I basically do some plumbing, I snake the drain, pull the clot out, restore blood flow, save brain. And the idea is that you give the patient a chance to not only rehab very quickly, but not have any stroke at all.
Yeah, it's amazing how you liken it to just snaking the drain and getting it out and saving a life. It's what they do best. And again, time is of the essence when you think you're dealing with something like this. Always call 911 if you have any questions. We're back after this.